is the role of hormones in IVF, and can you perform IVF without any hormones? Well, the only way how to perform the IVF without any additional hormones would be to perform a natural IVF cycle. We're talking about it elsewhere. In that case, we just follow the dominant follicle and try to jump in at the right time, triggering the maturation of the egg, harvesting the egg, and fertilizing it with the partner's sperm cell. However, having just one egg in this whole process makes this a rather unsuccessful project. It's usually an approach with a very low success rates. Otherwise, we need to specify which hormones we're talking about. We're probably mainly thinking about the FSH, the follicle stimulating hormone that's applied via the subcutaneous injections, usually from day 2 of the cycle, which overrides the natural process where just one dominant follicle is recruited and the other follicles actually don't grow and eventually disappear throughout the cycle. Here, with the increased FSH, the follicle stimulating hormone dose, we actually try to get most or perhaps all of the follicles started that are in the ovaries ready for this specific cycle. So the so-called antral follicles, which should be there usually in a count 5 through 10 or 5 through 11 in each ovary, which is considered the normal ovarian reserve. We need to follow their development. We need to eventually trigger the maturation of the eggs at the right time. On one hand, we try to avoid a too strong reaction, the so-called hyperstimulation. On the other hand, we're trying to get as many ripe eggs as possible. There are 2 other hormones that can play a role and that are sometimes distributed, and that's the estrogen and progesterone. However, these are the same hormones that every woman has in every cycle. Usually, most of these are actually produced by the dominant follicle, and these hormones shouldn't really present any increased risk or trouble for the patient during this IVF treatment.